Hello everyone, welcome back. This is Dr. Kristina Cubrilo Santos, your resident doctor of acupuncture, with another cupping tutorial for the neck and shoulder pain. Most people have experienced some type of neck and shoulder pain. I know I have throughout my life. And sometimes people even experience tension headaches because the muscles of the neck and the shoulders constrict the blood vessels that run to the head. Sometimes there are trigger points, referral pain from the trapezius muscle going all the way under the suboccipital area. Sometimes the neck muscles can also cause tension on the side of the head and even be implicated in jaw tension. And we can relieve all of this pain with simple tool of cupping. Now, my goal is to bring traditional Chinese medicine and cupping to the entire world. And since I am only one person and can't travel by myself to the entire world, it is my pleasure to bring you these short tutorials through my YouTube channel. So please click like and subscribe if you enjoy this type of content and if it's helpful in any way. And please share it with your loved ones and friends. I like to use Korean cupping method instead of the traditional Chinese method which uses glass cups with fire. And the reason for that is because the glass cups, can fall off the body if we utilize the method that I like to use, which is movement with cupping as well as sliding cupping. It is much more difficult to do that with glass cups. They can fall and break. So I utilize the Korean cups, which uses suction with this gun. And I also like to use silicone cups, which are readily available online. You can get them on Amazon if that is the venue where you'd like to purchase your supplies. Of course, if you are already a licensed practitioner, you can get it through different websites where they sell acupuncture and massage therapy tools and equipment. So to begin, let's say you're having this upper trapezius, shoulder, neck pain, and you just are rubbing it and it's not going away. So what I like to do is apply a little bit of oil. You can use any carrier oil. I like to use this coconut milk and acacia Senegal oil. Of course, you can use jojoba oil or avocado oil, and if you have none of that, even your house oil that you cook with can be used for that. I prefer oil over cream, but creams can work as well. It's just that they absorb much quicker. So I placed a few drops, like a quarter size, into my palm, and then I'm gonna rub my palms together just to warm up the oil. And then I'll apply it over my shoulder and neck area. So this is really for self-massage. Now, if you're a licensed practitioner or if you want to help a family member, which is something I encourage all my patients and clients to do, you're more than welcome to do that on your family and friends. But there are some precautions to take into consideration when doing cupping. So we don't want to be doing cupping over bruised skin, open wounds, broken bones. We don't want to do it on pregnant women in the last trimester. In the first trimester, you just want to be mindful of certain areas. So it's always good to talk to a licensed practitioner in your area. Now, the reason why I'm doing these tutorials in the first place is because not everyone has great practitioners available to them in their area like we do here in New York City. If you live in a rural area or you're somewhere else in the world, you might not have such easy access to this beautiful medicine and these practices. So this is where I come in to teach you how to do it on yourself and your loved ones. Now that you've applied the oil and let it absorb, if there was a little bit of excess oil, I will start with a silicone cup. And this is a small silicone cup. I'm using a small size because it's easier to mold around the muscle and move the cup along the muscle, which is a TDM method. So we're basically distracting the muscle tissue and moving the body while distracting that muscle tissue. And by pulling the skin and the muscle tissue with the cup, you'll see it with this suction, we're creating more space in the muscle tissue. We can also break up any adhesions in the muscles, and of course invigorate the flow of blood and lymph and of course qi in that area of the body. So I'm using the silicone cup. You just squeeze it like this. You squeeze it nice and tight between your fingers and then just position it on top of the upper trap. And you see how easy the suction is created, right? No need for fire and glass and all of this fancy stuff. Now, in order to test your tolerance to cupping, you can leave the cup on for a few minutes just to see how your tissue responds. After a few minutes or a minute or so, you can start to slowly move the cup. And I like to slide the cup along the muscle, the belly of the muscle, which the trapezius attaches to the spine of the scapula, as well as part of the collarbone, and also goes all the way up into the head and neck. So you can really access all of those areas, and you can also move your head and neck because the trapezius muscle allows for that head rotation as well as lateral flexion of the neck, and it also lifts our shoulders up, right? It elevates the shoulder blade. So that is the upper trapezius fibers. And as you see, it's creating some redness, some sha, as we say in Chinese medicine. And that is a nice reaction to have because we are invigorating the blood flow in that particular area of the muscle tissue. I'm going up the neck as well. And then trying to cover the lower fibers a little bit to the best of my ability. Now you can also go over the area of SCM. Now I do have to caution you, we have the carotid artery, we have lymph nodes in this area. So if you're a little bit hesitant working in this area, then it's best to work with a practitioner first and then feel the sensation so you can feel more comfortable and confident working on that area yourself. In Western massage and Western medicine, generally we are not going into the area of the anterior neck. However, in Eastern traditions, there's so many acupuncture points in the area of the anterior, lateral, and posterior neck that it would be a shame not to address that because SCM, the sternocleidomastoid, can have the referral pattern into the temples, even into the jaw, causing those tension headaches like I mentioned in the beginning. So I'm just gonna apply gentle suction over my SCM, and I'm also going to turn my head side to side. And the cups do come off because there's movement involved, but just apply it again over and over again until you're satisfied with how your tissue feels. You do not have to do this for longer than 5 minutes even, but if you not like a longer session, then up to 15 minutes is plenty. Now, don't focus just on the side where there's pain. Focus also on the opposite side, because what I find in my practice is sometimes a patient will come to me and say, oh, my right side of the neck hurts a lot. And then I do cupping on the right side and the left, and it's actually the left that has a lot more marks, which means that there's a possibility that the injury or pain actually originated on the opposite side than where they're actually feeling it. I also like to address the muscle pectoralis major underneath the collarbone, because that muscle, in addition to pec minor, can make us look hollowed out in the chest. And by constantly overcontracting this muscle tissue here, we're actually overstretching the muscles in the back between the shoulder blades, such as the middle trapezius fibers and the rhomboids. They retract the shoulder blades and make us look a little bit more upright when we're sitting or standing. So I like to slide the cup along this collarbone edge underneath the collarbone to address those fibers of pec major muscle. So that's as far as sliding cupping goes and silicone cups. Now I want to show you static cupping. So static cupping with these Korean cups, because we're working on ourselves, I'm using this extension cord, which allows me to plug the cup onto the area of discomfort with much more ease. So there's two ends to this extension cord. You'll plug the wider head to the cup, and then the other end goes into the suction gun. Okay, I dropped the cup, which is normal when you're working by yourself and on yourself. So this is how it looks like, right? Super fancy schmancy equipment. And like I said in the beginning, most people are complaining of tension in their upper trap, belly of the muscle right here on top of their shoulder. So I will use my hand to put the cup there, and then I'll do one pump just to see how my body reacts to one suction pump. And then some of my patients love 3 to 5 pumps, but just go gradually on yourself, or if you're working on a loved one, because you don't want to create unnecessary tension to the muscle because there's already tension there. So then I'm gonna do 2 more pumps because that feels good. And now I'll start to roll my shoulder to invite some movement into this cupping method. You can take off the cupping gun, and then slowly what I like to do is lift the shoulder up and down towards my ear about 10 times. 5, 6, 7, 8, 9, 10, and then I'll roll the shoulder 10 times. 5, 6, 7, 8, 9, 10, and then reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then to get the cup off, there's this little knob that you lift up, which releases the suction. And then you can see there is a suction cup mark there, but usually it goes away. I'm not talking about the marks from the edge of the cup, but the actual shot, the redness or the purple hue, it usually goes away within 2 to 3 days. However, on some people it can last even for a week, and I've had patients who've had it last for even 2 weeks. So it really depends on how quickly you heal in general. People who bruise easily, there is this tendency, even when we do cupping, whether it's sliding or static, for their cupping marks to last longer. Now, cupping marks are not like bruises. They are skin discoloration from the blood lifting up to the surface of the muscle tissue. And it's not like when we hit ourselves or bring trauma to our muscle tissue. Now, if you had a smaller cup, unfortunately I don't have a cup smaller than this, but let's pretend that this cup can fit on the back of my neck. So I'm gonna attempt to show that to you so you can see how easily you can access that part of the body as well, as long as you have the right tools in your hands. So here I'm gonna put this cup on the back of my neck. And if you have a very narrow neck, this might not work, but if you have a little bit of a broader neck, even a bigger cup will stay on your neck. So I'm gonna do 3 pumps, and then I'll show you how that looks like from the posterior aspect of my body and the lateral aspect of my body, right? So you see how the cup is firmly on my skin and muscle tissue. And then you can start again to invite some movement. Here I'm going into a rotation, side to side, one way, and then you can go the opposite way. And I usually like to do it 10 times. And then you can go into cervical extension and slight flexion. Of course, this range will be limited because the cup is pulling on the muscle tissue. Those of you that suffer from vertigo, when doing this, please be mindful because you may get dizzy, so we don't want that. And then again, you'll grab onto the cup at that little knob, you lift the knob and take the cup off. And that's it. I already feel such a difference between my left and right sides. So I'm definitely gonna do my right side as well. But I also wanted to show you the deltoid muscle, which I made a YouTube shorts showing that particular technique. And I got a request to do this long form video. I'll go straight into static cupping because the deltoid is a pretty big, juicy muscle. So you can, it's located right here on top and lateral, anterolateral and posterior aspect of the shoulder. It's covering the whole girdle right here. And I'll put the cup on like so, and then do 2 pumps, and 2 pumps is plenty for me right now. So I want to cover the anterior middle deltoid as well as the posterior deltoid, so I need 2 cups here. So I'll use my other cup and place it on the posterior aspect of my deltoid muscle. 1, 2 pumps, and that is plenty for me. You can also change hands. I have pretty dexterous wrists and hands from all of the years of working in this industry. However, if you can't plug the cup on the same side as your shoulder, just switch your hands and use the other hand to place it on your shoulder. And now with these 2 cups on my anterior and posterior deltoid, I'm going to bring my arm into flexion, medial rotation, and horizontal adduction, and I'm going to do the exact opposite for the posterior deltoid. So anterior deltoid flexes the shoulder, horizontally adducts and medially rotates the shoulder, whereas the posterior deltoid horizontally abducts, externally rotates, and extends the arm at the shoulder. Doing that movement a few times to invigorate the blood flow in this muscle tissue. And I might not do full 10 because I already feel this a lot in my deltoid muscle, and I'm gonna take it off. And as you can see, There is definitely some markings and some Sha developed on my anterior deltoid. I do push-ups, I do yoga several times a week, so I do use a lot of my anterior deltoid as well as my pectoralis major and minor muscles. And you can see some Sha on the deltoid, posterior deltoid, but not as much as on the anterior side. And with that, I'm going to conclude this treatment and then I can go to the other side. If you have any questions about this style of cupping or any questions whatsoever about Chinese medicine, please drop them in the comments below. I love hearing from you. I love getting requests. It gives me the idea of what videos to make and how to bring this medicine to more people around the world. And I hope to see you next time. Take care.